Good morning, and welcome to another series. I'm doing this is a second day of a two-part series. I'm talking about a healthy lifestyle series, and what I want to do is share with you the benefits of a nutritional detox. And we have an online program. We have a number of different health and wellness programs at Montgomery Heart and Wellness that go through the process of using nutrition in a way to improve your health overall. Yesterday, I talked about the benefits of nutritional detox on diabetes. We talked about the pathophysiology of diabetes in a very basic way. What I want to do today is I want to share some information on a patient that we managed at our center with congestive heart failure. Heart failure is the number one cause of morbidity to mortality, with cancer being a close second. Sometimes people say the other is number one. But heart disease is certainly a major cause of morbidity to mortality in men and women, and heart failure is chief among those causes. In fact, what drives our healthcare costs, perhaps as much as or more than anything, is congestive heart failure, with patients being in the hospital. The management of heart failure is very expensive. Patients who go for heart transplant suffer for long periods of time. It's very costly, and they also have other side effects. So what I want to do is share with you a patient that we manage at our center with congestive heart failure. Essentially, the effects of a nutritional detox on heart failure is going to be our subject today, and I want to share some information. So this patient came with congestive heart failure. He also has type 2 diabetes. He had hyperlipidemia. He had symptoms of shortness of breath, fatigue, and of course, he had a low ejection fraction. Now, you can have heart failure without a low ejection fraction. We call that diastolic dysfunction, or heart failure with preserved EF. But his heart failure was with a low ejection fraction, and it came with a lot of associated side effects. Now, he had flown into Houston from out of state. He had a known history of congestive heart failure. It had been diagnosed possibly 2 to 3 years prior. He had a single chamber defibrillator, and that's common with patients with heart failure because we implant defibrillators in them because they have a known increased risk of sudden death. That's one of the two mechanisms by which someone dies from heart failure. One is sudden death. The other is by slow progressive pump failure, which leads to multiple organ failure. And it's actually a slow, miserable way of dying. Type 2 diabetes, it was also a diagnosis he had. He was on medication for that. He had had a previous stroke. That's the CVA. He also had elevated cholesterol, and of course had a family history of heart failure and family history of heart transplants. And so this was something that was, in his genes, if you will. He had symptoms of substernal chest tightness that occurred daily. It was associated with fatigue. He wasn't sure of his EF, but he said he had a report of it being less than 20% a number of years ago. And so he had heard about us and our approach to treating patients with heart disease and chronic illness, and he wanted to undergo a nutritional detox. So that's what brought him to our facility. Now, on the day we saw him, his blood pressure was 96/48, which is relatively low. Now, this could be a normal blood pressure for some people, but for him, I thought was low given his body habits and his symptomatology. His heart rate was 78. His weight was 230 pounds. Now, this was the list of medications he was on. He took allopurinol, had a history of gout. He was on magnesium. Carvedilol is a beta blocker, which is commonly used to treat patients with heart failure. Tradjenta was for his diabetes. Eliquis, an anticoagulant. Entresto for heart failure. Torsemide is a diuretic for heart failure. He was on atorvastatin for his high cholesterol, more insulin for his diabetes, and of course a vitamin D supplement and a potassium supplement because he was on the diuretic. I want to highlight medication number 8, torsemide, 60 milligrams twice a day. That's a very, very high dose of this diuretic. Typically, you may use 20 milligrams once a day or 40 milligrams once a day. 60 milligrams twice a day is a very, very high dose. And I want you to put a pin in that because looking at this blood pressure and that very high dose of a diuretic, we were concerned that he was over-diuresed. Entresto. This is the highest dose of this medication. It lowers the blood pressure. It also causes water loss by means of salt loss by means of, I should say, it causes volume loss by means of natriuresis. And of course, carvedilol is a beta blocker. This is sort of a modest dose of that. So we got blood on him. Now, we drew blood the first day. Now, what we do in our clinic when patients come and it's part of our integrative care center is that we may evaluate the blood one day. We'll see them within 2 days, especially someone like him with a complex medical history. If we're starting them on a nutritional detox, we will see you within 28 to 48 hours to evaluate, what your metabolic status is. So we operate in like a quasi walk-in urgent care center in our patients who are acutely ill. Of note, of course, the glucose 158, that didn't bother me. But the BUN and creatinine, the blood urine nitrogen 176, notice the normal range is 7 to 25. His creatinine is 5.08. Again, normal range is 0.6 to 0.9. So he had significant kidney dysfunction. I'll put it that way. The other way is kidney failure. His GFR is 14. It should be greater than 60. At this GFR, and I'll show you a graph later, this is at a point where people get declared end stage renal failure for dialysis. But he had a high BUN and creatinine ratio, and with that very high diuretic dose, we had already started to decrease that dose on the first day, even before seeing these labs. So we started decreasing the dose. When I saw these labs, we actually gave him IV fluids to hydrate him. Even though he had a low ejection fraction, I thought he was very volume depleted. So we started to do that, and I'll go with his clinical course later. His cholesterol was normal. He was on a pretty decent dose of atorvastatin. And of course, he had signs of insulin resistance as a known diabetic. This insulin resistance score was high, and so he had insulin resistance. So what happened to him over the course of us seeing him? As I said, the first day we drew blood, he came in with a low blood pressure. We decreased some of his medications. On day 2 that we saw him, we saw that creatinine was 5.08. And I think it was like 48 to 72 hours after the first visit. We gave him a liter of IV fluids. And despite that, his creatinine remained elevated. In fact, the next day we brought him back, the creatinine was even higher. And I'll show you that information later. But throughout the course of us seeing him, his weight bounced around. Some of this is with starting off with diuretics. We removed some of the diuretics. Some of this weight loss was with detox. And then the weight gain was with hydration. And then it came back down with hydration and detox. Over the course of us seeing him in 2 weeks, his systolic blood pressure bounced around. A lot of this is due to the fact this medication doses were very high. So we made adjustments there, similarly with the diastolic blood pressure. And I'll explain this after I summarize what happened to him throughout the course of his both clinic stay and hospital stay, because we eventually admitted him to the hospital on day 4, the 4th day that we saw him. Heart rate bounced around over the course of this action. So let's get to some of the key parameters here. Let's look at his creatinine. So this is the first day we saw him, and actually it was 7 days later that we got the blood work back. So we saw him again on, I think, the 19th, and we drew blood on this day, and the results came back here. So the creatinine had gotten worse, despite the fact that we had started him on intravenous fluids to try to hydrate him more, improve the creatinine. So on this day, and the blue bars, by the way, they represent single data point. The green bars represent average data points. So this is if we drew multiple blood tests in a day, or if we got multiple measurements in a day, we would average those for that same day. So we admitted him to the hospital. His creatinine in the hospital that first day, of course, he had gotten 2 liters of IV hydration. He continued to get hydration in the hospital. The creatinine had finally started to come back down to 11.1. And over the course of this week's time, he received numerous liters of IV hydration, and the creatinine had come down to 2.4 and 2.78. So it got closer and closer to the normal range were just simple hydration and nutritional detox. He was on a detox diet during this time, and we also weaned his medications during this time. Now, notice the GFR. GFR stands for glomerular filtration rate. That's essentially the rate at which the kidneys filter the blood. At a filtration rate, as I said before, of 12 or less, really below 15, this is where nephrologists typically declare someone end stage. Notice his first several measurements of GFR were significantly below 15. So you can argue that he was probably at a stage where he had needed dialysis. However, knowing the fact he was on such a high dose of diuretics and other medications that affect renal function, we felt that if we simply hydrated him aggressively and reduce these medications to a certain extent, we can actually improve his renal function. The other component to this is what we call cardiorenal syndrome. As I said before, ways that patients die from heart failure is either sudden death or due pump failure. And one mechanism of pump failure is that you get multiple organs that start to decline over time, and the kidney is one of those organs. The liver is another organ, so they can also have liver congestion. We call that a congestive hepatopathy. So that was another mechanism that was contributing here, was the low cardiac function that was causing low perfusion or blood flow to the kidneys, and therefore low filtration rate. So as we look through here, the course of his GFR improved, and a lot of this was due to hydration and nutritional detox. As we placed him on a nutritional detox regimen, the greens, the phytonutrients from the vegetables that he ate, and these foods were all raw. They improved nitric oxide, decreased vascular resistance, improved overall hemodynamics. And we actually know this from studies that we've done on other patients, putting them on a plant-based diet with lots of greens, with lots of nitric compounds that improve nitric oxide production, and also decrease oxidative stress overall, which decreases the inflammation, which improves cardiac function. We see that overall cardiac function improved, and as cardiac function improved, in this case, renal function improved. So as we saw him over time, his functional status improved. So the first day he came, we put him on a treadmill and he walked the Bruce protocol for just 1 minute. By the end of this, it went from 1 minute to 3 minutes. So essentially, we saw his functional status improve by threefold. Additionally, with a modified Bruce protocol, went up to 13 minutes, functional status improved by threefold. We see the resting heart rate to peak heart rate. Again, the resting heart rate was very high. Peak heart rate did not increase very much. This improved significantly over time. So physiologically, he was much better over time as he proceeded with the nutritional detox. What happened with his medications? Well, as you saw, he was on 13 medications. We were able to essentially eliminate the vast majority of the medications he started on. The carvedilol, which was a beta blocker, was switched out for another beta blocker. So this was an exchange. And this one had, less of a drastic effect on blood pressure and reduced heart rate more. It's beta-1 selective. We left them on the vitamin D supplement. We put them on a coenzyme Q10, which enhances mitochondrial function, enhances function of cardiac muscle and overall cardiac output. Brain E3 Live is a blue-green algae, a superfood, a super nutrient that has super greens and minerals, same as sea moss also had minerals and superfoods. And he was given a lidoderm patch. He had arthritis in the knee because of his gout. He had a few gouty flares, and you tend to see these types of things, individuals who have arthritis or other type of inflammatory conditions. During a nutritional detox, we'll see flare-ups of some of the arthritic conditions. What we did is we started him on a lidoderm patch and eventually lidoderm cream just to suppress the pain topically so he didn't have to take an NSAID, again, having an adverse effect on his kidneys. So this patient did quite well. He eventually went back home after about 3 to 4 weeks in an integrative care center. We followed up with him remotely through a remote digital health center, and he continued to improve over time. What I wanted to do is share with you the effects of a nutritional detox. So here, although I'm a board certified cardiologist and I practice in the traditional method of using allopathic medications, which was used here. We exchanged one medication for another that had, some beneficial effects. We were able to wean him from the standard medications, but he was able to avoid other types of procedures, namely dialysis. And so here's an example of how a nutritional detox program used in an integrative fashion can be very beneficial for someone who had severe end-stage organ dysfunction. In this case, he had multi-organ dysfunction. The kidney dysfunction was mostly due to dehydration, but I'm sure there was some intrinsic kidney dysfunction, given the fact that he had high diabetes and high cholesterol. So he was at risk for kidney failure with just the diabetes and hypertension and high cholesterol alone. The heart failure exacerbated that, and also the severe dehydration exacerbated that even more. So let me just share a few words about our health programs. Yesterday, I talked about a healthy lifestyle series. Today, what I want to do is talk about our health programs in general. At Montgomery Heart and Wellness, we have a broad scope of things that we do. We see patients at our center. Patients fly from around the country, as this patient did, to come to our center. He was treated at our Integrative Care Center for 3 weeks. That included some outpatient care and some hospital care. We follow patients in the hospital if need be. And other patients follow us remotely. He followed us remotely after he went back home. And we have other programs where patients will get on our digital health center program. So let me just give you a quick overview. We have an online rebuild course. We have a number of patients who go into the rebuild course and they follow our program independently. There are lots of nutritional courses and things like that. So this is structured for someone who can follow a program independently, who may need assistance as needed, who can call into our center. The FoodX Healthy Lifestyle Series is a program I talked about yesterday. This is a 1-year program, as the rebuild course is, but this has more hands-on or interactive help up front. It has a 5-session, 4-week upfront course that's digital on Zoom classes. And then you have access to resource materials and access to our wellness program or our wellness team over the course of a year. The elite coaching, we have individuals who want to work directly with me. They may have more complex illnesses. And so the elite coaching program works well for them. They have lifetime access to our other programs, as well as the ability to come to our integrative care center. The integrated cardiovascular functional medical services, that's really our on-site integrative care center. And this is what you saw, how we treated this patient. Again, management of complex medical problems such as heart failure, diabetes, cancer. Patients come in for nutritional support. They're on-site cardiovascular treatments. We utilize, healing techniques, infrared sonotherapy, and the like, all in an integrated fashion. But also patients or individuals who have, advanced chronic illnesses who are under the allopathic care physician don't have to worry about completely leaving that, because we have experienced allopathic care services to help transition from the need of those services to a more natural way of healing your body. So there's a variety of things. Overall benefits, as I mentioned yesterday in other talks, we eliminate the need for medication, as you saw in this patient. We help you reverse diabetes. We help you improve your energy, stamina, vitality, improve your overall work, sexual, exercise performance, but help you take control of your life once and for all. More than anything that we do in our programs, we empower you as the patient, become your own health expert, your own health care provider to improve your overall function. So you want to learn more about what we do at Montgomery Heart and Wellness, you can get information about a Healthy Lifestyle Series program. That's montgomeryheart.com lifestyle. It's on the screen. You can schedule an assessment call to talk to us about a Healthy Lifestyle Series program or any one of our other programs. You can also just simply call us. You do it the old-fashioned way. Many patients call, or individual call, to talk to one of our staff, let them know what your health issues are. And if you need to talk to me personally, just let my staff know, and they'll arrange a time where I can call you if you have questions. Now, of course, I call you only about questions about, how we can help you. I don't do consults over the phone or the like, but if you need information about how we can help you and how our programs might benefit your health, please feel free to call us and we'll try to help you any way possible. Until next time, I want you to take care of yourself, try to eat your vegetables, and all the best to you for the best health.